Alan Lofthouse, who is Deputy Head of Health at Unison, which is, as I say, the organisation which conducted this survey. Good evening, Alan. Were you surprised by the results of this survey?
I think we really were, because what we wanted to understand through this survey was the impact that these queues are having on staff and ambulance workers, but also their views about the impact it's having on patients. And as you've quite rightly said, some of the statistics about longer than 12-hour waits, and not always in the comfort of back of an ambulance, sometimes in a corridor or in the car park, queuing up with other ambulance crews waiting to offload. 50% of people said they waited over 6 hours to discharge their patient, which means there's 6 hours where they're not able to go and answer other calls that might be happening in the local area, other people that are in need of an ambulance. It ties them up at hospital. And almost half of people said that almost every shift they have an element of car park care. So I think they're pretty strong findings that we've got from people. And your listeners may know these experiences. They may have been on a trolley waiting to enter an A&E.
Is there an assumption, do you think, within the system now that car park care just happens? So maybe there's an expectation now that it's okay for someone to wait a couple of hours outside in an ambulance, whereas previously it was, if not taboo, but not acceptable.
I mean, I'm a former paramedic myself, and over 10 years ago, when I stopped practicing as a paramedic, you might wait for 20 minutes, half an hour, maybe sometimes an hour is an extreme case. But now you're seeing this regularity of 10, 12-hour waits outside hospitals, and it is impacting on patient care. And this is no criticism of the hospital staff that are working in A&Es trying to see patients. But 2/3 of our health workers that we asked, ambulance workers, said that patients' dignity and privacy have been compromised. People are trying to ask you questions about what's happened to you whilst you're stood around with lots of other people in a corridor. That's not exactly great privacy. But there's also people that have their deterioration of their conditions. They're not safe. And their care is compromised. 83% of our people said that. They said things like chest pains, breathing, and as I think you mentioned, a very small number, but they're still quite worrying of people deteriorating to the point where they passed away. And I'm sure that the hospital staff would have taken those people into the resuscitation rooms and would have immediately done something to try and save them. But it is having an impact on patient care, and that's why we're highlighting the story.
I wonder about the impact on ambulance workers too. Do you see a correlation between the retention rate of ambulance workers and what's been going on?
Yeah, so 60% of our respondents said that it was significantly impacting their mental health. And 93% of people, says nearly everyone, said they've got issues with late finishes, missed meal breaks, things like accessing the toilet, having food. If you're stood with a patient and the family for, 6 or 7 hours, during that time, you need water, you need to use the toilet. And these things aren't very easy for staff, in either ambulances outside looking after some pretty sick people or in a corridor caring for people. So this is making people think, is this the job for me? And it's such a shame, because I know that the ambulance career, being a paramedic, is just one of the best jobs you can do. But it's not standing in a corridor for 7 or 8 hours.
But you're attracted to it, presumably, because you like to fix things, you like to be a problem solver, you like to help people. And when you feel impotent because they're, you're stuck in an ambulance with someone and there's nothing you can do, that completely undermines that.
Absolutely. Yeah, you're there to go out and give emergency care, and actually looking after patients long-term in corridors isn't the rewarding job that you thought it would be. So this is making people question it. But we have got solutions. We have got ways that we're suggesting these things can be fixed. There's got to be better flow through hospital, and that's particularly around the discharging of patients back in the community. But the government have committed to increasing community care. They want to drive more work from hospitals into the community.
We've heard this, though, haven't we? 1,000 million times. I think Wes Streeting is great, actually. I like the cut of his jib, and he talks a lot of sense, and I'm sure everyone behind the reforms is very well-meaning, but we've heard so many times about preventative care, stopping people from coming into hospital in the first place. We've heard about social care, sorting that out so there isn't so much of a burden on the NHS and so on, community care, yada, yada, yada. We've heard it a million times. I am of the view that we need to face facts that this health system was devised at a time in the 40s and 50s for a different world, a different demographic. And now I think that this idea that we can keep on with it funded in the same way, catering to everyone, to all needs, with a growing population, with a very rapidly aging population, is just not realistic, however much money we put into it.
I mean, people will want a health service no matter what. These conditions aren't going anywhere. And actually, the better the health services in the community, the better you are able then to direct people. So, giving ambulance services and 111 services better strength in order to say, you probably don't need us, you should go and see your GP. So actually being more firm with patients when they're accessing inappropriately, but also making sure that we have enough GP appointments. So, changing the healthcare system isn't going to magically, bring a whole load of new GPs or a whole load of new nurses into the system. We need the
I
healthcare
wonder
system
about
as it is.
accountability, though, Alan. And I mean, of course, most people who go to A&E have every right to be there. And I'm talking. I have sampled the delights of A&E just a few weeks ago with one of my children. So who am I to talk? Because if there is a concern, I'm right there. But is a big issue as well that there are some people in there who should not be there really, because it's not really an accident or an emergency, and they should really be seeing their GP, or maybe just trying to treat themselves at home.
Yeah, I mean, there is all kinds of stuff like that. And actually, what we want is improvements in the 999 and 111 service where they're actually able to do more. So, you train up those staff that take the calls from people to really direct them in ways. And they do a fantastic job, the people that work in those call centres, to try and redirect people. And occasionally ambulances are called for people inappropriately, in which case we want our paramedics to have the confidence to be able to say, do you know what, this isn't an A&E admission. What I'd like to do is refer you back to your GP, or I'd like to refer you to the community service. The last government spent 14 years dismantling community services, so they just aren't there. So we've created a vicious circle, but with steady investment over a period of time, we can rebuild those community services and therefore give patients a way of not relying on A&E or 999 as their, one-stop medical shop.
Here's the thing about 111 is that my husband is of the medical profession. He's a doctor. He's actually a surgeon. So unless, your leg is physically hanging off, he'll say, no, don't bother going in. And he's very much of that view. And he always says, don't call 111 because they will just tell you to go to A&E. And I have to say, I mean, I've not dialed 111 for myself, but when I have called on behalf of my children, that is pretty much always the advice, is go to A&E, which I understand why they're doing it. It's to sort of cover themselves, and it's often not a doctor you speak to on the phone, so maybe they just feel that to be safe, if you're talking about young children, it's best to send them to A&E. But I do wonder how much extra work the 111 service has put on A&E.
Yeah, I mean, the trouble with 111 services, of course, they used to be run by the NHS. It was NHS Direct. Then it got privatised, and actually got private companies now who are running the 111 service. And of course, it's easier. Rather than taking the risk, investing and putting clinical and doctor staff in, you have call handlers who've got very little option but to say, do you know what, I think you should go to A&E or not. So there is a way to improve the 111 service, and it isn't working as it is, just being out to tender every 2 or 3 years to whoever is the cheapest provider of it. You've had doctors running it before, you've had all kinds of people, and the NHS can run those services and they can make them really effective, but it needs that joined up care. It really does.
So Unison is calling for 111 to be run by the state again, to be run as a public sector, right?
Yeah,
That's
It does nothing by privatizing it, because in order to make money from it, there's two ways of doing that. It's to run an inferior service, in which case you can run a profit from the public purse, or you run down staff terms and conditions by bringing in new staff on different contracts. It's a simple way privatization works in the NHS. It doesn't do any favors for the public at all.
Thank you very much for speaking to us.